of mental health and crime continues. Annika will stay with us. I'm joined by Dr. Maria Haberfeld, Chair of John Jay's Department of Law, Political Science and Criminal Justice. We're also joined by Manhattan Borough President Mark Levine and by Rebecca Fischer, Executive Director of New Yorkers Against Gun Violence. Thank you all for joining us. Mark Levine, I'd like to start with you. Is there a sense in New York City that things are not as safe as they were even 6 months ago?
Well, unfortunately, the numbers do indicate that we're moving in the wrong direction in a number of categories. We've had 13 shootings so far in Manhattan. That's up from 8 last year, and a very painful 3 weeks with the murder of a 19-year-old, Crystal Bay in the Eves, and the Burger King in East Harlem. Of course, the horrible death of Michelle Go, and painfully over the weekend, the loss of Officer Rivera, who was well known here uptown. He was a kid from the neighborhood in Inwood, so we're feeling this particularly acutely, and no society can accept this. We can't accept this in Manhattan or New York City. We have to attack it on all fronts. As the mayor said, we have to stop the flow of guns into this city. We have to go after the gun runners. We have to do more to get people the services they need so they don't pick up a gun. The after-school programs, workforce development, etc. Yes, we have to go after the mental health crisis as well. And I think that Mary Brosnahan was absolutely right when she says we need more capacity to treat people who are chronically mental ill. Manhattan has lost hundreds of inpatient psychiatric beds in the last decade. We have almost no medical stabilization beds that allow people to step down. So we have to expand capacity to treat people who are in crisis and potentially a threat to themselves and others.
Maria Haberfeld, specifically on the issue of mental health, it seems as though we do tolerate the current situation because not enough is being done about it.
Well, I think I said it a number of times already. I think it's a disservice to people with mental health issues to label them as responsible mostly for what's going on in New York City. And granted, what others on your program said, there are very important issues and they are part of the problem. But to me, the problem is much larger. The disjointed efforts of various agencies that do not take into consideration what we know about crime, why people commit crimes. And I mean people who are criminologists, criminal justice professionals, who are very rarely, if ever, part of any task force, any discussion about how we need to tackle it. So we're talking about gun runners, we're talking about mental health, we're talking about economic problems. But we as criminologists, we are the ones who should be participating. We must participate in this to address it in an effective way. At this point, if you want an analogy, it's almost like trying to find a cure for COVID by talking with politicians and people who administered the injections. But we are missing the ones who are working in research labs to find the cure. And this is what's happening right now in New York City.
Which, Rebecca Fischer, let's bring you in on this conversation on that, because there are so many different components to it. What do you think needs to be the main focus right now moving forward?
Well, I agree with Maria that we need to speak about mental health and gun violence with very specific nuance and sensitivity. We don't want to embrace the gun lobby's messaging, which is that over 40,000 individuals a year are shot and killed because of mental illness, and criminalizing those individuals. Only 4% really of interpersonal gun violence is caused by a clinical mental illness, or the individuals who are perpetrating those crimes are individuals with a clinical diagnosis. That being said, we can't end the conversation there. We are dealing with a public health epidemic, and there are a number of different risk factors that are contributing to the gun violence that we're seeing in our city and across our country. And we need to be able to address that with mental health support, particularly because often victims of gun violence are more likely to suffer from mental health symptoms in the aftermath, and that trauma and cycle of violence that ensues is part of the problem. And so we need to be pursuing solutions that address all of those risk factors as a public health problem. And for example, one of the solutions that this city has embraced and continues to invest in, and I know that the mayor is behind, are community violence intervention programs that employ individuals who are credible individuals from the community who may have been formerly incarcerated themselves, know where the hotspots are, and those are the individuals who are intervening and engaging with individuals who may be committing those crimes. We also need to be providing more social services, as the borough president said, to individuals who are living in our most vulnerable communities and who are disproportionately impacted by COVID-19, by housing instability, by gun violence, to ensure that they have the support, because those go into those communities. And there has been a surge in gun sales and gun trafficking, particularly since March 2020.
Dr. Haberfeld, I'm just about out of time here, but I wanted a quick thought from you as to what the top priority should be again, with what you've heard from the other panelists. What would you like to see Mayor Adams doing tomorrow on the issue of mental health?
I would like him to include people who are professionals, not just in the field of law enforcement and practitioners, but I would like him to include criminologists and criminal justice academics to help identify the root cause of these events that, as was mentioned by one of the participants, are only peripherally related to mental health issues.
Mark Levine, I'll come around to you for a final thought here on this. We have heard that these issues get momentum at one moment, and then once the crime fades from the headlines, the issue loses momentum. What can be done to make sure there are real solutions here, that we don't see these situations coming back again and again and again?
Well, we can't let that happen yet again. I do think that the last 3 weeks have impacted this city so deeply that there is real momentum to address this crisis, and the mayor appears to be deeply committed to that. This is a long-term fight. Some of the solutions are going to take a while to implement. We have a desperate shortage of the kinds of housing solutions that people with mental health need to come in off the street, such as supportive housing, which is affordable housing with 24/7 social services built in. We need to double down now on investing in building that housing. That won't be quick. We need a long-term commitment to solve this problem for New York City.
Mark Levine with us from Manhattan, along with Dr. Maria Haberfeld, chair of John Jay's Department of Law, Political Science, and Criminal Justice, and Rebecca Fischer, executive director of New Yorkers Against Gun Violence. Thank you all for being with us for that this morning.
Thank you.
Thanks so much.
It is 7:20. We'll